Assalamu alaikum. I'm Dr. Rukiya Tanjum Lopa, lecturer, Pharmacology Department at Bosundhara Addin Medical College. Our today's topic is anti-TB drug. As tuberculosis is most common in our country, so we should know some information about tuberculosis. Most commonly organism for tuberculosis is Mycobacterium tuberculosis and Mycobacterium bovis. Morphology of Mycobacterium tuberculosis: it is acid-fast bacilli. They are neither gram-positive nor gram-negative, non-spore forming, non-motile and non-capsulated. Anti-TB drug: first-line anti-TB drugs are isoniazid, rifampicin, ethambutol, pyrazinamide and streptomycin. Second-line anti-TB drugs are amikacin, para-aminosalicylic acid, kanamycin, levofloxacin, fluoroquinolones, clofazimine, rifabutin and rifapentin. Isoniazid: it is a highly efficacious synthetic prodrug, act against rapidly multiplying organism. Pharmacokinetic properties: given orally, well absorbed from gut, can cross blood-brain barrier and manages, metabolized by slow and rapid acetylation, excreted by renal route. Mechanism action of isoniazid: integral component of cell wall is mycolic acid. Isoniazid block mycolic acid synthesis, so no cell wall synthesis. Adverse effect of isoniazid is hepatitis, peripheral neuropathy, hypersensitivity, CNS disturbance and GIT upset. Rifampicin: it is broad spectrum antibiotic and tubercular. These are enzyme inducer, act on both extracellular and intracellular organism, act against slowly multiplying bacteria, metabolized by liver and excreted by bile and urine. Mechanism action of rifampicin: inhibit against DNA dependent RNA polymerase, interfere RNA synthesis, therefore interfere protein synthesis and bactericidal in action. Adverse effect of rifampicin is liver damage, cholestatic jaundice, influenza-like symptom, allergic response and GIT upset. Pyrazinamide: it is a prodrug and synthetic drug, much more active against dormant bacilli. By adding this drug, it has shortened the duration of treatment. It prevents relapse. Mechanism action of pyrazinamide: it is taken up by macrophage, converted to pyrazinoic acid by intracellular enzyme pyrazinamidase, causes acidic environment and sterilizing effect, kills the organism. Adverse effect of pyrazinamide: hyperuricemia, hepatotoxicity, GIT upset. Ethambutol: it is a synthetic drug and it is a prodrug. It is tuberostatic, selective for Mycobacterium tuberculosis and less lipid soluble. Mechanism action of ethambutol: it inhibit mycobacterial arabinosyl transferase, prevent arabinoglycan formation. It is essential component of cell wall. Cell wall is defected and anti-TB action. Adverse effect of ethambutol is color blindness, retrobulbar neuritis, loss of visual acuity, and advice is baseline and periodic visual acuity test. And ethambutol is contraindicated in children below 6 years. Streptomycin: it is polar, water soluble drug, active against extracellular organism. Mechanism of action: bind with 30S ribosomal subunit and inhibit protein synthesis. Route: parenteral. Adverse effect: ototoxicity, nephrotoxicity and neurotoxicity. Rationale of combined use of anti-TB drugs: to shorten the duration of treatment, to broaden the spectrum of coverage, to reduce the toxicity, to avoid resistance and to prevent relapse. TB treatment regimen according to national guideline: category 1 in case of new case, initial phase 2 FDC as isoniazid, rifampicin, pyrazinamide and ethambutol 4 FDC for 2 months, and continuous phase 2 FDC as isoniazid and rifampicin for 4 months. And in case of previously treated cases, 4 FDC for 6 months in case of TB meningitis, bone TB and non-resolving lymph node, 4 FDC for 12 months with levofloxacin. This slide shows TB treatment regimen according to weight. Conditions for using second line drugs: when resistance to first line drugs, failure of clinical response to conventional therapy, in case of serious treatment limiting adverse drug reaction, when expert guidance is available to deal with the toxic effect. Disadvantage of second line drugs: less potent, more toxic effect, low therapeutic index, always need expert opinion and more expensive. Steroid along with TB drugs is bilateral adrenal tuberculosis, tubercular meningitis, tubercular pleural effusion, tubercular pericarditis, renal TB, miliary TB, and TB in GIT. Thanks for your patience. Thank you.